Well, good afternoon, everyone. My name is Lauren Letillier. I am the Director of PR and Communications for North Florida Regional Medical Center, and welcome to our Ask a Doc segment. We're so excited to have you today. Today, we're going to be talking about some orthopedic services that we have here at North Florida. We have Dr. Edward Jaffe of the Orthopedic Institute joining us today. Thank you so much for joining us,
Hello.
sir.
It's great to be here, Lauren.
We're so excited to have you. Before we get into the meat and potatoes of things, we go through our pleasantries first. Thank you guys so much for joining us. We'd like to do a sound check, make sure you can hear our message throughout the entire presentation. Also, we love to see where you guys are watching from, whether you're watching from here in Gainesville. We've had people been watching us from Chicago and some from even Guatemala. We've had a wonderful viewership, so we always like to say hello to us in the comments, and we'll say hi back and tell us where you're watching from today. Thank you so much for joining us. Also, we're going to be taking questions at the end of this presentation for Dr. Jaffe live here on the air. So if you have any questions for Dr. Jaffe today, go ahead and put those in the live feed in the comments section, and we will get to you and answer your questions live here on the air. So don't feel like you have to hold on to those questions. Go ahead and submit them at any time. I'm going to be keeping track of those throughout our presentation. And we're going to go from there. So thank you guys for joining us today again. And Dr. Jaffe, thank you so much for your time. We're so excited you're here.
It's my pleasure to be here.
So Dr. Jaffe, tell us a little bit more about yourself. Give us some background on yourself so we can get to know you a little bit better today.
Absolutely. So I'm an orthopedic surgeon at the Orthopedic Institute, and I've been with the Orthopedic Institute for 27 years. And been on the medical staff at North Florida Regional Medical Center for that entire 27 years. I grew up in Florida, but I went away to college. I went up to Dartmouth College, which is in New Hampshire.
Oh, yeah.
And then after college, I had a little bit of trouble debating what I should do with my life.
As we all do.
A lot of people go into medicine, a lot of physicians know from early in life that that's what they wanted to do. Maybe there was a parent who was a physician, or they were just attracted to it from an early age. That wasn't the case with me. So after graduating from college, I ended up joining the Army. And that
awesome.
Was one of
Thank you for your service.
Oh, you're very welcome. That was one of the biggest and best decisions in my life, and I owe a tremendous gratitude to the Army, because I was actually a medic on a special forces team, and the training I got there is what really started my interest in medicine.
Oh, that's awesome. I didn't know that about you. That's fantastic.
So after 3 years of service, I got out and decided I wanted to pursue a career in medicine.
Awesome.
And I had to take all the pre-med classes, because I didn't do that my first time around in college. I was more of a liberal arts undergraduate student, and so I had to go back and take all the science classes. So I came to Gainesville, to the University of Florida, where my youngest brother was finishing up. So he graduated and left Gainesville, and I came to Gainesville to visit him, and I stayed and never left.
It's funny how Gainesville does that to you.
It does draw you in
a little bit.
And I loved Gainesville from the first time I came to visit. It felt like a place that I could make home, and I did. So I ended up going to medical school at the University of Florida and stayed for my orthopedic residency. And then when I finished that, I joined the Orthopedic Institute and have stayed there, as I mentioned, for 27 years.
Oh, that's fantastic. Awesome. Well, thank you so much for your history. We love to learn a little bit more about our physicians every time they come on. We really appreciate you sharing that with us.
Absolutely.
So tell us, what are you going to talk about today?
So I wanted to talk about some of the services, the orthopedic services that myself and my group provide here at North Florida Regional Medical Center. And I wanted to concentrate on 3 surgical procedures that I have seen the greatest advancements in my 27 years of practice. And that would be robotically assisted total knee replacements, the anterior approach to total hip replacements, and then the reverse total shoulder replacement. So we can, discuss those procedures and different topics around those procedures.
Absolutely. We got a lot to talk about today. We better
do.
get started, don't we? So before we get started, kind of give us a lay of the land. What do you see in the patients that you treat here at North Florida Regional Medical Center? What type of orthopedic conditions do they come to you with for your help?
So that's a good basic starting question. As I'd like to start answering that by, these surgical procedures that I'm talking about, in which we've seen tremendous technological advancements, are used to treat advanced arthritis of the knee, the hip, and the shoulder.
Gotcha.
And we all use the word arthritis, but I have a feeling that many people understand different things in the definition of that word. So I just kind of want to go over what I think about when I use the word arthritis.
Oh, yeah.
So the first thing is joint pain. So it's a inflammation or a condition of the joint that leads to pain. It often leads to stiffness. And the basic hallmark of arthritis is when you think of a joint, it's where two bones meet together, so they join. That's why we call it a joint. And the way those bones have to glide smoothly and that, over each other, and that's how you have mobility in the joint.
Absolutely.
And what can happen over time, and for a variety of different reasons, that cartilage can wear down. And when I talk about cartilage, I want you to think about the smooth, shiny surface at the end of an uncooked chicken bone. And we have that same type of cartilage at the ends of our bones in our joints.
Okay.
And when it's nice and healthy, it's pearly and shiny, and it has great properties for gliding over itself when the opposing cartilage surfaces meet.
Okay.
But for a variety of different reasons, that cartilage can wear down. And it wears down enough, it can be completely worn, and then you're having irregular bone surfaces grinding on irregular bone surfaces. And that sounds painful, and it can be very painful.
It sounds very painful.
And it can be accompanied by joint stiffness, joint swelling, and limited function. And so those are the type of conditions that we are treating with these operations that we're talking about today.
So when we talk about these, the 3 joint replacement advancements that you're going to talk about, why? What's the why behind why are they so advanced? What has evolved over the years?
So that's a good question, and we can. It's kind of the meat of the talk, and we'll kind of discuss them one by one.
Oh yeah.
But the joint replacement surgery has been around for a long time because arthritis is as long as our species has existed, but it's more prevalent now because we're living longer, because the joints tend to wear down with time. It's just it's a wear and tear phenomenon.
Sure.
And so as we've increased our life expectancy, our lifespan, more and more of us suffer with arthritis. And so along with that has come the human ingenuity of trying to solve that problem. And these joint replacement operations could not have succeeded if it weren't for advancements in anesthesia, allowing people to undergo surgery with not being awake to experience the pain of the actual surgical procedure itself, and infectious disease and antibiotics, because the early attempts at replacement, when we didn't have antibiotics available, had a high risk of infection that made it unacceptable as a treatment option. So with other advances in medicine came the advances in joint replacement.
I see.
And then, as with anything else that human beings do, as we do it, we're always trying to improve it.
Oh yeah.
And so these advances that I'm talking about in these procedures have to do with the improvement of these operations so that patients can go through it more safely, more comfortably, get better end results, and have actually quicker recoveries. So that is the impetus behind these advancements.
And I think one of those advancements that is important to discuss is now, for ortho procedures, we offer robotic surgery options, which is something you offer too, and we'll get into more details with that. But that is really, so let's talk about robotic assisted total knee replacements.
Absolutely.
How does that procedure, how is that procedure performed? Can you go ahead and walk us through it?
Absolutely. So modern knee replacement surgery has been around for 5 decades or more, and there were multiple efforts leading up to that. It didn't just all of a sudden appear on the scene, but it was a gradual transition to the point where it became similar to modern knee replacement, and there have been steady advancements over those 5 decades. But traditionally, when I was in training and up until the last 5 years or so, it was done with what we call manual instrumentation. So it's very important how you align a knee replacement surgery. And let me just stop here.
I can only imagine.
Let me just stop here a second.
Oh, yeah.
We call the operation a total knee replacement, but that often would make people think that you're just lopping off the knee above the joint and below the joint and putting a whole new
exactly.
knee in there. But that's not what's going on.
Okay.
What we're actually doing is just resurfacing the worn out surfaces with artificial surfaces that have much more endurance than our own worn out surfaces.
Okay.
And part of doing that to make sure that it lasts for a very long time once it's put in is we have to get the alignment right, and we have to make sure that the ligaments on the outer side of the knee, what's called the collateral ligaments, are well balanced. And that's just going to make an artificial knee feel more natural to the patient. And obviously that's very important.
Oh, yes.
So we're going to resurface the worn out surfaces. We're going to realign it because often the worn out knee is in very bad alignment, either bow-legged or knock-kneed. And we're going to rebalance it. We're going to try to create equal tension in the collateral ligaments that are remaining so that the knee will feel more natural to the patient. And all of those goals are better achieved with the technological advancement of robotic assisted surgery. What we do is often will require a CT scan so that we have a digital map of the bony anatomy of the patient. And then prior to surgery, that information is entered into a computer system that is at the OR table side during surgery. And then during surgery, we will map the patient's knee and then align that actual mapping that we do at surgery with the digital information of the CT scan. So now we have complete information about the patient's knee. And then we can use that to, before we ever do the first surgical cut to remove the worn out surfaces, we can virtually balance the knee so we can decide the optimal position to put in those artificial components that are going to resurface the knee.
Wow, that's incredible.
It is amazing technology, it really is. And so what this allows us to do is end up with a knee with very precise bone cuts of the surfaces, because there's actually a robotic arm that the surgeon controls. The surgeon's making all the decisions, but it keeps the saw plane exactly on line when it's making those bone cuts, removing those worn out surfaces.
So precise.
It's very precise.
That's great.
And it really helps us achieve our goals of realigning the knee accurately and rebalancing it. So what we're seeing in patients that we perform this operation on with the robotic assistance is a higher rate of successful outcomes where the patient is very satisfied with the condition. They're making quicker recoveries, and although it hasn't been around long enough to prove it, the anticipation, the expectation is it will, due to that better alignment and better balancing, you'll end up with a knee replacement that will last you hopefully a lifetime.
Wow, that's fantastic. Oh, and so this is something we offer at North Florida. That's fantastic.
Absolutely. North
Love
Florida
to hear that.
has been a great partner, and it required expensive equipment to buy the robotic equipment.
Sure.
And the hospital purchased that equipment so that we can do this operation at North Florida Regional.
Oh, that's awesome. So let's talk a little bit more about anterior hip replacements. Can you tell me more about that procedure as well?
Absolutely. So traditionally, there have been several approaches to the hip. That's part of the history of surgery, is really understanding the anatomy, and so that you can approach the area that of disease, in this case arthritis, in the most effective way, causing the least harm to the patient.
Sure.
So there are several different approaches to the hip. For my first 20 years of practice, so most of the way that I approached the hip was through what's called a posterior approach. The anterior approach was around, but it was mostly used for certain specific types of fractures or infection, but it wasn't used routinely for hip replacement surgery. And then it became more popular over these, I would say, these last 10 years,
Okay.
especially over these last 5 years.
Okay.
And the reason why it has become more popular is because when we approach the hip posteriorly, we have to cut through some tendons and then repair them at the end of the case. And that's true of some other approaches as well. But with the anterior approach, we're able to go in what's called an intermuscular plane, or between muscles. So we're able to separate the muscles without cutting the muscles or the tendons.
And that is, I would assume, one of the largest traumas of having a hip surgery is that cutting of the muscle.
It is. I mean, it's still, people do well with the posterior approach.
Sure.
It's just that there are, in my mind, and not every orthopedic surgeon agrees with this, but in my mind there's some advantages by approaching it anteriorly. I think that I'm seeing patients have quicker recoveries with this anterior approach, and that, again, some other surgeons might debate that, but in my hands and with my patients, that's what I'm seeing.
Wonderful.
And there's also one of the known complications with hip replacement surgery is the possibility of the artificial hip dislocating from the artificial socket. It doesn't happen very often, but it can happen. And there is some indication that you'll see less of that with the anterior approach.
Interesting.
So the combination of a muscle sparing approach, a quicker recovery, and potential risk of decreasing the complication of a hip dislocation has led me to adopt it as my primary approach for hip replacement surgery. And I think that's been another great advance. So this is not so much a technological approach, but technological advancement, but a surgical approach advancement.
Okay, great. That's
but
fantastic.
Along with that, there's been improvement in the manufacturing of the components
Yes.
of the artificial hips.
That's what I heard.
So you're getting a new bearing surface, right? So the hip is a ball and socket joint, and we're placing the ball in the socket. Well, there are new materials for that ball and socket that can give it greater longevity, and also for the metal backing of that support those bearing surfaces. So the whole goal is to give patient a pain-free joint, increase their movement and their activity level, and to decrease their risk of complications and increase the longevity of the device so that hopefully they can just have one operation.
Oh, that's fantastic. I love it. So let's talk about that reverse total shoulder replacement as well, because shoulders are, I know I have some family members that have terrible shoulder problems, and they can be so painful.
It absolutely can. It can be very debilitating.
Yeah, talk about that offering for patients.
Absolutely. So shoulder replacements have been around for a while, but not as long as the hip or knee, but certainly several decades. And one of the reasons that the surgeons who designed the reverse shoulder replacement were motivated to do this is that patients who have a combination of rotator cuff weakness or insufficiency and advanced arthritis in the ball and socket joint of the shoulder often would have early failure of their shoulder replacements, because without that rotator cuff, there were abnormal forces on the shoulder when it caused especially the socket component to loosen.
I see. Okay.
So some very bright surgeon came up with the idea of thinking outside the box, for sure, of putting the ball component of the artificial replacement on the socket side of the natural joint, and putting the socket side on the ball side of the natural joint.
I see. Okay.
And what that did, it allowed the joint to be brought down to its normal position in patients who did not have good functioning rotator cuff tissue. Without that good functioning rotator cuff tissue, the ball would tend to ride up. But now it keeps the ball down, or that arm down, in the right position, and allows the patient to use the power of their deltoid muscle to lift up their arm, which with a insufficient rotator cuff, they weren't able to do
Can't
before.
even lift it over your head.
So it's been a tremendous advancement. And one of the other
awesome.
things that we found with this technique of reverse total shoulder replacement is it actually is a more durable and stable component than the primary anatomic shoulder replacement that we had been doing previously.
Wow.
So sometimes your surgeon may decide that it's indicated even in a person who doesn't have a bad rotator cuff condition. It still may elect to proceed with a reverse total shoulder replacement over what's called the primary or anatomic shoulder replacement, because there still are some benefits potentially in the durability of that implant. So another great advancement that I've been fortunate to watch occur during my time in practice.
A lot of fantastic orthopedic options here offered here at North Florida Regional Medical Center. We have Dr. Jaffe here of the Orthopedic Institute joining us today, talking about and answering your orthopedic questions. So if you have any questions, I do see a few that have been put in the comments by our viewers. So thank you guys for submitting your questions. Go ahead and continue to do so. We only have a few more things to talk about, and we will get straight to those questions. So thank you guys so much for tuning in today. Actually, one of your patients has actually logged on, and she says, Dr. Jaffe just did my anterior hip replacement. I love it. I'm ready to roller skate. So that's awesome news. Thank you so much for sharing, Hayes. So that's awesome. So let's go ahead and talk about, when should someone, and we can talk about this very briefly. So when should someone say, I need to have this done? I need to have this joint replacement. What point do they need to get to?
Sure. So basically anyone that's experiencing joint pain that bothers them enough that they're noticing it and wants it looked at should schedule an appointment. We're happy to see everybody. The majority of people who come in to see us do not need joint replacement surgery. There's other things that we can do besides joint replacement to help limit their pain and improve their function. And in almost every case, unless the joint is just so badly worn out that there aren't other options, we will try non-surgical options first, such as physical therapy, medications, injections, sometimes a brace. So there are different things that we can try before going to surgery. But when somebody notices that their quality of life is negatively impacted on a daily basis, that they have significant pain that is not well controlled, that they are missing out on a lot of the activities in life that they would like to participate in, but that their joint limitations are stopping them, that's the time when we have the discussion about joint replacement.
Yeah, that's great to bring up. So, a lot of people, when they talk about orthopedic surgery, they go, well, some people put it off, but when you get to that point, I'm in so much pain, I'm limited to what I can do in my life, especially now during COVID time. Dr. Jaffe, is it safe to have surgery at North Florida Regional Medical Center?
So that's a very important issue for everybody. And I think North Florida Regional Medical Center has done a great job of managing the COVID crisis. When it was appropriate, they decided that there was a time to halt elective surgeries until the situation could be brought under control. At first that was done by a state mandate from the governor, and then subsequently the hospital itself was concerned about the filling up of ICU beds, taking care of COVID patients, and maintaining that ability to do that.
Sure.
So they have been out in front of this issue from the very beginning, and things are in a much better state now than they have been. There are universal practices applied in the hospital for patients, visitors, and hospital staff to protect everybody. There's universal mask wearing, there's social distancing, there's frequent hand washing, there's the environmental services team that keep the hospital clean. They have done a heroic job of...
Heroic is definitely the way I'd put it. That was the word I'd use.
Constantly keeping all the surfaces clean, and I am not aware of any patient that's come in for a surgical procedure that has contracted COVID. Every patient that comes in for surgery has to be tested within a few days prior to surgery to make sure that they are not testing positive even if they're asymptomatic.
Absolutely.
And I think the hospital is doing an excellent job in managing the situation, and I feel safe about bringing my patients here for surgery.
That's fantastic. So if you are having any type of pain in your joints, you know, it's not, this isn't the time to put it off, I would say. I would say, you know, still feel like you can still go through and make those health decisions for yourself.
Well, I think the last thing you said is absolutely true. Everyone has to make that decision for themselves. So if you can tolerate your symptoms and you feel uncomfortable and you wanted to wait, that's a perfectly understandable decision to make. And it's perfectly reasonable to discuss, you know, with your doctor when you come in for an evaluation. So there's different ways of approaching everything in life, and there's still a lot of unknown, and we all have to make the most reasonable decisions we can for our health care.
Absolutely. Well, we are here if you need us. So I think we're ready to take some questions now. Dr. Jaffe, are you ready?
Yes.
Okay, all right. So we're going to go with some questions from our audience that have been submitted. So thank you guys so much for tuning in today. And go ahead and submit your questions in the comments now. We're going to be answering your questions live here on Ask a Doc with Dr. Jaffe of the Orthopedic Institute. So the first question that we have for you today, sir, let me go back. All right, so Gail says, about how long is the recovery for hip replacement? And is it dangerous to have, for someone with a pacemaker, to have a hip replacement? So 2 questions, I guess.
Yep, and those are both very good questions. So obviously recovery is going to vary a little bit from person to person, right? It's some people bounce back very quickly and other people take longer. So what I'm finding with hip replacement surgery, that most patients stay in the hospital an average of 1 day. Some might stay a little bit longer. In some cases, patients are ready to go home the same day. People are on a walker for at least the first 2 weeks. And we get them started in physical therapy, and a lot of people can be off of a walker or a cane or any assist devices by 1 month. I would say that's fairly typical. To make a full recovery to where you feel like you're gotten the full benefit from the surgery, some people can do it in as little as 1 month. I would say more typically 2 months, and some people can be longer. So there is a range, but I would say between 1 to 3 months is the majority of patients will fall into that range.
Gotcha. Okay.
And about the pacemaker, so I think that leads to a broader topic, and it's an excellent question. By the time we've been on this planet long enough to have our joints wear out, other body systems may be having trouble as well.
Yeah, that's true.
And so to get through surgery safely, we have the patients be in as good a physical condition as they possibly can be.
Okay.
So if they have an underlying cardiac condition that required a pacemaker or required other treatment, stents, blood thinners, whatever the cardiac treatment may have been, we would need to involve their cardiologist to make sure that they are an acceptable candidate for surgery, and whatever needed to be done to get them that way would be done first. And that goes for other conditions as well. Diabetes has to be well controlled prior to surgery. So there are certain parameters for blood sugar levels that we have to have, because uncontrolled diabetes puts you at higher risk for complications from surgery.
Right.
You also want to have as optimal a weight as possible, because if the weight is too excessive, that can put you at risk for complications. So there are a series of evaluations that we do to see about patients' other medical conditions that have to be optimized before they go through surgery, so they can have a safer and smoother experience going through surgery. I hope that answered your question, Gail.
Absolutely. Thank you, Gail, for your question. We really appreciate it. So if anyone has any other questions, go ahead and submit them in the comments of our live Facebook feed here, and we'll answer them live. Dr. Jaffe, we have another question that's come in. Are joint conditions hereditary? What do you think?
So that's a very good question as well. So in a lot of cases, yes, they are. But it's not an either or. So it's not 100% hereditary or 0% hereditary, but oftentimes it is. So, and patients often know this themselves because they come in and they say, my father needed hip replacement, or my my brother needed hip replacement. So you can see the pattern in families,
Right.
and that's obviously a strong indicator.
Sure.
But other people might not have that same family pattern. So they may have had a particular anatomic alignment that gradually led to wear and tear. They may have had previous surgery on a joint that led to gradual wearing of their cartilage. They may have had an injury in the past that gradually led to the condition. So yes, in often cases it is hereditary, but in many cases also it's not.
Okay, that's interesting. That's great insight. So another question for you, sir. Who is a candidate for joint replacement surgery? Can you talk about all those things that you've talked about today? Who would be good candidates for those surgeries?
Sure. So this does kind of recap some of the things that we've already discussed.
Sure.
So it's going to be somebody who is having significant limitations from the joint that we're considering surgery for. So it affects their daily quality of life. If it's a lower extremity joint, their ability to walk, their ability to bend over to tie their shoes, their ability to get comfortable to sleep at night. Same thing with the shoulder. The ability to get comfortable to sleep at night is a common complaint with shoulder problems. The limited range of motion, the pain that's not controlled, failure to have improved on non-operative measures. And people that are, you don't have to be in perfect health to have a joint replacement. You obviously can have other conditions, but those conditions have to be well controlled.
Sure.
And so those are the main criteria for deciding if somebody is a good candidate for surgery.
Fantastic. Well, Dr. Jaffe, I think we're going to close out. Is there any parting thoughts you'd like to give to our audience before we end today?
I know that sometimes we get caught up in what is very present with us at the immediate time, and right now, obviously, that is this COVID pandemic.
Sure.
But we also, and that can get people down. I would like to leave with a more uplifting thought, in that we will get past this. This will not be with us forever. We'll get back to a more normal form of life, and we should really, or I am anyway, very thankful for the ingenious people that have led to these medical advancements that allow me to help patients enjoy a better quality of life.
Oh, that's awesome. Yeah, no, it's been so wonderful to see the advancement throughout the years and what we can offer patients right here in Gainesville. It's incredible. It's really awesome. Thank you so much, Dr. Jaffe, for joining us. Dr. Jaffe of the Orthopedic Institute. We are so excited to have him here today, and I hope you have enjoyed his presentation. We are so excited to have all of you. We had so many people watching today. Thank you all for tuning in, and we'll see you next week for another Ask a Doc segment on next Thursday. We'll see you then. Thank you so much.